knock on doors for unlikely voters. They're not picking up the phone and calling people who they don't think are going to vote. Thereby, those issues, their questions, their perspectives, they're not baked into the policies of these folks if and when they get elected. And unfortunately, that has real consequences on healthcare. This pattern I'm going to show you has been effectively replicated in every city we look at. Let's look at New York City first. This part of East Harlem had this very specific precinct had a nearly 35% lower voter turnout rate. Same part of East Harlem has a nearly 20-year life expectancy drop. You might say, well, no, that's just New York City. Let's go to Detroit. Southwest Detroit, this little corner, elbow of Detroit, has 24 industrial sites. These are asphalt plants, oil refineries, chemical facilities. These places are polluting the air and the water that people have to drink and breathe. And as a result, people live on average 7 years less. They go to the hospital more for heart attacks. They go to the hospital more for asthma. It is no surprise to you then to learn that of all of the places in Detroit, Southwest Detroit has the lowest voter turnout. And of all the places across Michigan, Southwest Detroit has the lowest voter turnout. But let's make it more concrete because maybe folks are not getting the message. Those industrial plants had to go somewhere. Where are they going to put them? Are they going to put them where people are voting? No, they're going to put them where people are not making any noise. And guess what? We in the healthcare system have to clean up the mess. And you as a taxpayer have to clean up the mess. Because many of those patients have state-sponsored health insurance. Let's look at the whole region of the stroke belt. You could do the same thing for heart attacks, same thing for pulmonary embolism. You could do the same thing for cancers. It's the same exact pattern. The same states that had restrictive voter laws, the same states that curtailed access to the vote are the same exact states that have worse mortality. In this case, it's about stroke. The stroke belt states are states that have a higher incidence of stroke and death from stroke. And they're the exact same states that had to require pre-clearance in the 1965 VRA, Voting Rights Act. So that's all doom and gloom, but how do we fix this? One way that we fix this is by simply helping people vote. It's their constitutional right. Simply by helping people vote. Why? Because when people vote, they're labeled as likely voters, campaigns make contact. And so that's what we do at our organization, Vote ER. We create 3 different tools that help people register to vote in a nonpartisan way across the country. The first is by leveraging something called the Healthy Democracy Kit. This is a lanyard that doctors wear and a badge that they have. And on the badge, patients can use that to check their voter registration or to register to vote. They can also get a vote by mail ballot. There are 50,000 doctors, nurses, medical students across the country using those. 2, those posters. We have posters, discharge paperwork like you see there. Each one of those is coded to a specific hospital so that when somebody registers to vote at Hopkins or UCSF or Mayo, it's actually on a public board. And once you know, these hospitals like to compete against each other. And so we have a big competition every year where hospitals compete against each other to see who is registering the most voters. And then lastly, we work with community health centers to send text messages like the one you see there. Let me tell you about how this is used out in the wild. So Dr. Stager is a pediatrician in Ohio. She uses her lanyard that you see there and her badge. And she asks patients in her social history, do you smoke? Do you drink? Are you registered to vote? If people say no, no problem, use this QR code. I have to go see another patient. There's a 24/7 hotline here that can walk you through the whole process of voter registration. Okay? It's about transferring authority, transferring trust to the system. The system takes care of the rest. We don't need another thing to do. Doctors do not need to be learning how to do voter registration, but we can tee it up. As I mentioned, we have 50,000 folks around the country that are doing this. Dr. Smith is a primary care doc out in rural North Carolina. She has our posters, our discharge paperwork, our handouts in her clinic so that patients who are in the waiting room, they can all sign up and check their own voter registration. There are 700 hospitals and clinics like this across the country. Dr. Stager, who you just met, was taking care of this woman, Lauren, who was 19 in the 2020 election. Lauren had never been registered to vote before. Dr. Sager helped her. She got registered, which is cool. But here's the cool part. And this is why NBC News covered the story. She went home and registered her parents and her sisters, none of whom had actually registered to vote before. And they all voted together as a family for the first time. This is the power of one clinician in a community. Okay, we've helped about 80,000 people either register to vote or get their vote by mail ballots, like Lauren. So in total, we've helped about 80,000 folks to vote, about 50,000 individual kits shipped across the country. Lots of hospitals doing this, lots of associations partnering with us, like the American Medical Association, the AMA, the National Association of Community Health Centers, pediatrics, etc. Okay, but I know what you're all asking. Cool, this is great. Everybody was helped and you had conversation. Did anybody actually vote? Is anyone thinking that or no? It's just like, okay, cool, Alister, great work. These people voted, and they voted at higher rates than the average voter, way higher. Okay, 20% to 20 percentage points higher. Of all the folks who were helped to register to vote, the voter turnout rate was 85%. That compares to 66% for the general population. But here's the better part. We did a sub-analysis which demonstrated that this intervention is even more impactful for people who had never voted. There's something about when your doctor is talking to you about voter registration or the hospital's bringing this up, there's something special about that actually wakes something up in a non-voter to make them realize, oh, this is actually important, I should probably do this. And so we've been not just mobilizing individual clinicians and individual patients, but we mobilize organizations too. Back in 2020, we started something called Civic Health Month, which is in August. The whole month is devoted to healthcare-based voter registration. There are about 200 hospitals and organizations doing this now across the country. And we've put pressure on some of the institutions like the AMA. This is not recorded, right, John? It is recorded. Okay, the AMA is a wonderful organization that has incredible power and yeah, really well respected. So the AMA does have some sway, and it is helpful to get resolutions passed the AMA, because then you can go to hospitals and say, hey, you see the AMA just said this, you need to do it. So we worked with the AMA to get a resolution passed that proclaims voting as a social determinant of health, i.e. voting is something that hospitals could and should do, or helping patients register to vote, to help make people healthier. We also worked with HHS and the VA to implement some of our best practices, things that we're doing at hospitals across the country, into clinics to help them use this on the day-to-day. We also have a campaign where we're working with governors across the country to get them to proclaim August as Civic Health Month. So in Massachusetts here, we got Charlie Baker to sign a proclamation deeming Civic Health Month as August here in Massachusetts. We have a similar campaign in New Jersey, Wisconsin, and Florida that are all coming through, and we'll see what happens. All right, rounding the bend here. One more check-in. No one's getting a Longwood? No? Okay. I hope what you're taking from this is that there's a connection between civic health and physical health, that it is not only legal to do voter registration in healthcare setting, but encouraged, and that we as clinicians and as hospitals have a role to play in that, right? But here's what I'm learning most recently. It's not just about voter registration. There are patients in our society who have just signed off of the whole project of voting. They've signed off of the whole concept of the government being useful and helpful. They don't believe it works. So why should I take my time away from my two jobs that I work, or shuttling my kids from here to there to do this? For those people, it's not going to be good enough to just make it convenient for them to register to vote. We actually have to go out of our way to demonstrate to them that it can meaningfully impact their lives. And then we can have a conversation with them about voting. So here's one example. We have a lot of different examples. In the interest of time, I'm just going to give one. The Affordable Connectivity Program is a brand new benefit. Just came out about 16 months ago. It gives people in this country up to $75 a month to pay their phone bill or to pay for their home internet. Why? Because in this country, we have 20% of the population still doesn't have internet at home. How the hell are we going to do telehealth, telemedicine? How are people going to get a job How are people going to apply for SNAP or WIC or benefits for their or housing benefits if they don't have home internet? So this program is very useful. You have to have one of these things to qualify: Medicaid, SNAP, SSI, etc. What on a 0 to 100 scale, like say 100% of the patient, 100% of people are eligible for this. Okay, how many percentage? How many? What's the percent you guys think actually have signed up for this thing? So if like there's 145 million people who are eligible right now for this program. That's like 40% of the whole population. What percentage has signed up? You guys think it's like 70%, 60%, 10? That's actually, wow, you guys are very nihilistic, man. It's like 25%. But yeah, exactly. I mean, you already get the drift here. Basically, it's 25%. So we have 75% of the population that hasn't accessed this funding. Okay, $14 billion sitting there that could be helping people, not being used. And so I mentioned I would give one other example of the work we're doing through Link Health, which is another program that we run. We literally help people access this benefit while they're waiting there. We put money in their pocket while they're in the waiting room. We have the community health center text them about it. We put it in their discharge paperwork so they know about the program. They can get money when they go home. Why? Because it's important. We can then reach out to them and do telehealth, telemedicine, etc. So what we do with this program, we're all over the city of Boston in community health centers. We're in waiting rooms. We have a text message program. We ride around on a mobile van, that's me, checking people's blood pressure and then signing them up for this program. We've screened 1,200 people for this thing. We've distributed $50,000 so far since November. The vast majority of the people that we're helping are either African American, Latino, and qualify through things like Medicaid or SNAP. And that's a little bit of the work that I currently do. I want to end with an allusion that was made earlier. John mentioned that I was at the White House just last year. I was part of a nonpartisan program called the White House Fellowship, which Lyndon Johnson started in the 1960s. The whole goal of this program is to pull presumably high-achieving mid-career people, although that's debatable, into the federal government for 1 year. 14 of them per year get selected. These people like Air Force pilots, astronauts, doctors, lawyers, etc. You learn together. You get staffed on one principal, and you kind of follow that person around the whole year. And my assignment was I was split, of course, because they love torturing me. I had two jobs, is what I'm trying to say. I was with the vice president, and also I was in the West Wing Office of Public Engagement. I did a lot of things, but during the whole year, I have been thinking, like, what is the thing that I'm really going to take away from this, right? Like, what's the thing that I'm going to, like, hold on to from this? Of course, the relationships are important, the friendships, but what's the thing, like, why am I here, Okay, one day in August, hot day in August, like one of those days in dog days of summer where you can almost like feel the ions in the air, and I had literally just closed the gate out of the front entrance of the White House. I'm looking at Lafayette Park. Bang. I see the biggest lightning bolt I have ever seen in my entire life. And I mean, it was so big, I could feel the heat of this thing. And I got out of Dodge. I was like, oh, I'm getting out of here because I'm going to be struck next. So I start running. I then see Secret Service on their bikes pedaling like all hell in the opposite direction back to the lightning bolt. I'm like, what the hell are you guys doing? What are you doing? There's a lightning bolt over there. And they're like, yeah, we know. 4 people just got hit. And I was like, oh, shit, I got to go back. God damn it. So I turned around, ran back to the scene. By the time I got there, 4 people had been struck. All of them were pulseless, meaning they were all dead. We began CPR. I was able to get the Secret Service personnel that were on site, who are real heroes, by the way, to go get me 2 AEDs, because that's all we had. And unfortunately, we were only able to use the 2 AEDs on the younger of the 2 people. We were able to shock both of them back. And the problem is, y'all, that we were able to shock both of them back. One of them had an incredibly strong rhythm, the young man, and I felt like we had him for sure. The young woman, I thought we're probably not gonna have much luck here. But the next day or 2 days later, the young man died, the guy who had a very, very strong rhythm. And so I was thinking the worst about the young woman, because if he didn't make it, she's probably not going to make it. 2 days later, read the news. The young woman not only survived, her family reached out to me. They had found out that I was a doctor that was there. And I met Amber. And Amber is an international human rights expert. She's an artist. And she's my friend. And we have been in touch ever since. I brought her back to the White House and took her through the Oval Office and got her to kind of just hang out with me for a day. And since that time, I've been thinking maybe this was the real reason that I was supposed to be there. And so I started with this framing, and I'll end with it. What do I owe to the game of tennis? And the answer for me is very clear, and that's everything. So thank you guys very, very much for listening.
We know that Alister has a date.
I do have a date,
So
but we have 25 minutes.
Q&A.
So yeah, I do want to ask: is everyone sure? Like, no Longwood, no one's gonna get a. No, you guys are good. Okay. Yeah. Any questions or anything that I can expand on or?
Other than saving someone who'd been struck by lightning, is there another memory from your White House experience that you're gonna carry with you?
Oh my God, there's so many.
Really